Welcome all. Today we have come with another episode on discussion about IBD, that is Inflammatory Bowel Disease. There are many questions in people regarding the features or symptoms or treatment of Inflammatory Bowel Disease. Not much useful information is available. So here today we are going to discuss about IBD. So here I am, Dr. Riya S, MD Medicine, and we have with us Dr. Krishanu B, gold medalist, DM gastroenterologist with us to discuss about the same. Good evening, sir. So today starting with our discussion, my first question would be, so what is IBD?
IBD means inflammatory bowel disease. As the name says, it is a kind of inflammation. What we mean by inflammation is that some ulceration can occur within the GI tract, and it leads to bleeding, pain abdomen, blood in stool. So it's a kind of inflammation leading to some ulceration, which is a kind of erosion, and in some cases there may be stricture formation or perforation. That means there is rent or hole which is created due to this disease in the intestinal lumen, and that is IBD. In a single word, this is inflammation of GI tract.
Okay, sir.
Riya, commonly we get a question that this is the most common question. The first question you have asked, that is, what is IBD? And another question people ask, what are the types of IBD? What are the different kinds of IBD? Could you please throw some light on different kinds or different types of IBD?
So there are two types of IBD. One is ulcerative colitis and another is Crohn's disease.
Okay. So can you please elaborate a little bit more?
Crohn's disease would be you mentioned inflammation of the bowel.
Right.
Crohn's disease will be inflammation of the bowel. It can involve the entire of the bowel, and sometimes it's more predominant in the small intestine with also incidences where it involves the colon, that is large intestine.
Do you mean that the other type, which is ulcerative colitis, it does not involve the whole colon? Am I right?
Yes, ulcerative colitis is generally restricted to the large intestine, that is the colon,
right.
And it can involve only a very small, up to 2 to 3 centimeter of terminal ileum, that is the distal part of small intestine.
Distal
Otherwise,
means
outer part of ending part of small intestine, and it is mainly a disease of the large intestine.
So what we get from your discussion is that ulcerative colitis can involve only a part of our GI tract, and Crohn's disease can involve any part of our GI tract. Is that correct?
Yes.
Okay.
Yes, sir.
Okay.
So, sir, my next question to you would be, how common is it in India?
Well, recently there has been an increase in IBD incidence in India. In recent times, we have seen that we are getting more and more patients of IBD in our day-to-day practice. It was previously been considered as a disease of the Western world or the developed world, but nowadays IBD is increasing in India. As for example, I can say that there has been a study called Access study, which shows that among the Asian countries like China, Hong Kong, Singapore, Maldives, India, and different other countries, India has the highest prevalence of IBD among these Asian countries, which is around 6.6 per 1 lakh population. And so it is increasing in India. It is gaining more and more importance and being highlighted more and more.
Sir, is there any region in India where it is more common?
No, there has been a difference of this trend from what is seen in Western world and what is seen in India. We know that in Western countries, IBD is more common in their northern parts, and it is a bit less in their southern part. But India, there is no such area-wise or region-wise distribution. There may be different causes, different hypotheses regarding that. But India being a tropical country, the most important one or most highlighted one is the uh, exposure to sunlight. India being a tropical country, there is no dearth of sunlight in any part of India. So there is no region-wise difference in IBD distribution, but it is more sunny in the northern parts of the Western countries in Britain or in USA. So in their countries, it is more common in northern parts, but in India, it is similarly distributed everywhere.
Okay, sir.
Can you please describe the most another most important question, that is there any difference between rural population and urban population in IBD distribution or IBD prevalence?
Yes, sir. In our country or Western countries are almost everywhere they are developed. In our country, there is a prominent divide between urban and rural population. In India,
Okay.
it is more common in urban population
Okay.
because the urban population has some more risk factors of the disease. There is more incidence of smoking in urban population, more incidence of intake of oral contraceptive pills in females, which can be a risk factor in Crohn's disease.
Okay.
Then there is decreased breastfeeding. Exclusive breastfeeding is beneficial, but mm, often in urban population, breastfeeding is not exclusive, which adds to the risk factors. And besides, there is intake of antibiotics,
Hmm.
diet, and other lifestyle unhealthy lifestyle choices that are more prevalent in urban areas uh,
So I
give it a
think
more predisposition.
it is the result of urbanization or shift towards more machine dependent way of living.
Yes.
So this is the reason you want to say.
Yes.
Okay. So I think we should discuss about some risk factors of IBD.
So before that, so please discuss about a male-female predisposition. Which
Okay.
population do you?
In India there is always male preponderance, although the difference is not much. I can say from the data of established or well known studies that the male female ratio of IBD in India is around 1.3 to 1.4 is to 1, which
Okay.
means that when three men people are affected by IBD, there are two women who are affected by IBD or inflammatory bowel disease. So
So
it is slightly more common in males in India, but it is the difference is
not
much more individualized in Western countries.
okay.
In Western countries, ulcerative colitis is more common in men, whereas Crohn's disease is more common in women. But India, there is one-way trend, that is, males are slightly more prone to develop IBD.
Okay, sir. So please discuss about some risk factors of this disease we are talking
Okay,
about.
what do you think? What are the common risk factors? This, this is one of the most frequently asked questions, that why do people get IBD, or how will we prevent, so that if we know beforehand the risk factors, we can prevent development of IBD. Is there any risk factors? What are they in your opinion?
So, if we talk about some preventable risk factors, they
Right,
can be smoking,
right.
then intake of antibiotics. While some are necessary, there is often intake of rampant and unnecessary intake of antibiotics, which can hamper our intestinal flora, which can predispose.
These are the preventable or modifiable risk factor, isn't it? So
Yes.
I would like to highlight some of the non-modifiable risk factors. Like there are some genetic factors. We have a signature genetic makeup of our own. So these are dependent on our chromosomal distribution or chromosomal development. So those who are the students of microbiology or genetics would be more familiar to these terms. Like there are some commonly investigated or commonly found association of genetic polymorphisms with IBD. Like there are NOD2 gene, or there are some there is a reaction which happens in our human body which is called autophagy. So there are polymorphism or a little bit of difference between autophagy genes like IR, GM, ATG, L61. These are some autophagy genes. So there are chromosomal factors or genetic factors which are predisposing factors for IBD. There are other factors also, like IBD is an interplay between some genetics, between some microbial factors, between some environmental factors. So in microbial factors, we have seen that there are some protective bacteria in our intestine, and some of these protective bacteria are reduced. uh, these have been seen to be reduced in IBD patients, like bacteroids, bacillus, especially lactobacillus, firmicutes. These are some protective bacteria which stay or which live in human GI tract. These are reduced in IBD, and whereas we have seen that when people have active flare of IBD, that means they are having disease manifestations. These bacteria are reduced, and when their symptoms are improved with treatment, or they improve from IBD, their progeny start to increase. So these are some bacterial factors, protective bacterial factors, which in some or the other way get reduced in IBD patients. And there are some other risk factors, as you have said, that smoking, yes, smoking predisposes to IBD, especially Crohn's disease. And there is another hypothesis, I would rather say it hypothesis because this is not proven, which is called hygiene hypothesis. You have already discussed about it, that lack of exclusive breastfeeding, protection from getting exposed to bacteria or microbial organisms in early stages of life by means of protected environment, protected water source, uh, treating infections with antibiotics very early in life. These are some factors which modify our immune system, immunity, and this modified immune system start recognizing our own body components as our enemies, and they start uh, producing or start creating some hazards which is called autoimmunity. So these are the factors which are risk factors for IBD.
Okay, sir. Thank you for a very good uh,
Thank you.
description. Sir, now, what are the common age groups associated
Yes,
with different types
IBD.
of IBD?
Yes, IBD is generally a disease of younger adults. In India, we have seen, or the data shows, that it is most prevalent among 25 to 45 year of age group, whereas in Western country there is a bimodal distribution. Age group of 20 to 39, and people living in the in between 60 to 79 year of age group. These are the two age groups which are most commonly affected by IBD in Western countries, but in India, it is most commonly a disease of younger adult population, where, to be more specific, ulcerative colitis is more prevalent among people around 35 to 40, and Crohn's disease around 38 to 42 years.
Okay, sir. Sir, will you please discuss about some clinical symptoms of patients of IBD, people
Yes,
suffering
that
from the
is
disease?
that is another important aspect. People often ask how we will recognize IBD at an early stage. So, to start with the clinical symptoms, the most common clinical symptoms are related to our GI tract, and among them, most common is diarrhea. Diarrhea for a prolonged period. We generally treat diarrhea as acute when it is seven below 7 days, and chronic if it is more than 4 weeks or more than 1 month. In between 7 days and 4 weeks, we call them protracted diarrhea. IBD most commonly present with chronic diarrhea. If somebody is having increased number of bowel movements, increased liquidity of stool for more than 1 month, always IBD should be thought of. And another most common manifestation is bleeding per rectum, blood in stool. Sometimes during the flare episodes, there is inability to hold the bowel, so people feel urgency to go to toilet, and after clearing bowel, there is a sense of incomplete bowel clearance, and there are some nocturnal symptoms. Generally, in case of uh, milder disease entities, or disease entities like IBS, irritable bowel syndrome, people may complain of diarrhea, but there is no nocturnal symptom. That means there is no diarrhea during late night. But in IBD, nocturnal symptom is a very important symptom. People used to get up from bed uh, in the middle of night, and they have to rush to toilet. So these are the telltale sign of something happening in our GI tract. Something like IBD is happening in our GI tract. Second most important symptom is blood in stool. Another symptom is weight loss of weight, and we call a significant weight loss when people lose more than 10% body weight in 6 months. So, if there is a significant body weight loss, it can be a symptom of IBD. There may be pain in abdomen. There may be anemia, decrease in hemoglobin level. So we recognize it early as a manifestation, what is called as exercise intolerance. People get exhausted very easily with lesser amount of exercise or lesser amount of exhaustion. They are unable to tolerate that strain. So these are the most common symptoms of IBD. One is diarrhea, chronic diarrhea, especially chronic diarrhea, blood in stool or bloody diarrhea, weight loss, abdominal pain, and uh, loss in, anemia, decrease in hemoglobin. I think there are some manifestations which are not directly related to our GI tract. We often get these questions that is there any other clinical manifestations or other symptoms which are specific or which can mimic IBD?
Yes, when a patient is suffering from IBD, often we see they are associated with other manifestations which are not intestinal, which involves other regions of the body.
Like,
It can affect the eye.
okay,
There can be uveitis, which is there is a part of the eye which is called the uvea, and there can be inflammation in that part. There
so
can be
what happens when a person gets uveitis?
the person can have, along with symptoms of IBD, the
Right,
intestinal symptoms,
right.
patient can have redness of the eyes which is painful. There can be watering, there can be loss of vision. Associated uveitis is particularly a very painful condition, painful red eye with
Okay.
blurring of
So
vision.
there will be pain in eye and there will be reddening and watering from the eyes, right?
Yes.
Okay.
There can be episcleritis. Episcleritis is a condition where the patient will see blood vessels, engorged blood vessels. That is, for patients, it will be redness in the eyes, in the white portion of the eyes. There will be redness, and on examination, a doctor can distinguish what it is. But there will be, for the patients, there will be redness of the eyes.
Here I have one question that during the spring or winter months, so many people get red eyes. There is itching or watering from the eyes. How will they distinguish it from another disease entity and from IBD? Is there any difference?
The patient can have associated intestinal symptoms, and also if the patient is having IBD and associated eye symptoms, they will be recurrent.
Okay.
Not only season specific, even after the allergic season goes away, the patient can still get it. So
Okay.
it should raise a doubt in the patient's mind that
Right.
it is something else and I need to get it checked.
So what I get from your discussion is that when these symptoms are occurring on and on, more frequently or more recurrently, then we should not ignore that.
There can
Okay.
also be some skin conditions, dermatological manifestations,
Right.
something like pyoderma gangrenosum. There can be which is a small lesion, infective, often mistaken as infection, and there can be bleeding from it, and it's a skin lump. There can be erythema nodosum, which are red, red nodule-like lesions on the
Okay.
patient's body.
So, in which part of our body these lesions do occur?
They occur peripherally in the limbs. They
Okay.
are more visible.
Okay.
So if the patients are getting that, along with other symptoms, they should be careful.
There are some other systems in our body which are also involved in
And
IBD, I
sir,
think.
in case of dermatological manifestation, one important thing is psoriasis.
Okay.
Psoriasis, there is scaly lesions in the body which involve the flexural components, and psoriasis is often patients on their own, they present to a dermatologist and they get diagnosed as psoriasis, and they may also be harboring IBD. So
Okay.
all patients of
I
psoriasis
think
may be needed to.
one thing I would like to mention that in our GI practice we have seen so many referred patients who are being treated for some arthritis. I think this is these words mentioned because arthritis is one of the most commonly associated extraintestinal manifestation of IBD. There may be pain and swelling of joints, low back pain, or there may be some pain in the hip. So, so many patients suffer from arthritis who are later being diagnosed as actually extraintestinal manifestations of IBD. I think this is also a very important manifestation of IBD, that is arthritic manifestations.
Arthritic manifestations.
So I would rather say that if somebody is suffering from arthritis for long, they should visit their rheumatologist to know which kind of arthritis it is, and whether they are having this arthritis as a part of their IBD, IBD or not, isn't it?
Yes, sir.
Okay. So, is there any other manifestation apart from this, or
Apart
which IBD people can get?
apart from this, there can be some hepatobiliary symptoms,
Liver related, right?
liver related symptoms. There can be fatty liver associated with IBD. There is a particular condition called primary sclerosing cholangitis (PSC), which is often found associated with ulcerative colitis (IBD). It is one important factor. Patient may be presenting with jaundice. So in that case also, if the jaundice is found to be of the type of pri- primary sclerosing cholangitis, he or she may be needed to get checked for IBD.
Okay.
And
And I'd like to point one more thing regarding this PSC. We have seen that so many people who are being treated for IBD, we prescribe them LFT or liver function test. So these hepatobiliary manifestations are more commonly diagnosed on a finding of asymptomatic rise in or asymptomatic derangement of liver function test. Suppose there is a component called serum alkaline phosphatase, which is a component of liver function test. So when we find asymptomatic rise in serum alkaline phosphatase, we keep in mind that is it PSC in IBD patients, so we screen them for that. So this is one of the important aspect of different blood tests also in case of IBD. So these are the different types of extraintestinal manifestations. One is anemia, skin manifestation, manifestations related to our joints, our liver and biliary tree. There are some eye related manifestations. There are some endocrinal manifestations. So these are the common symptoms and extraintestinal manifestations of IBD.
okay, so thank you, sir, for today's
Thank you.
discussion. It was very enriching. And in the next episode, next part of this episode, we will come with diagnosis and treatment of IBD. So stay tuned for it. This much for now. Thank you. Thank you,
Thank you.
sir.
Thank you.